Personalized medicine is being practiced every day, and we're learning from its successes. So, for example, if you're unfortunately diagnosed with breast cancer, you will likely receive a diagnostic to let you know if the breast cancer drug Herceptin will work for you. It works for about 25% of those diagnosed with breast cancer. And there are other targeted medicines that have recently come to market. For example, there's a new drug for cystic fibrosis that works for only 3 or 4% of people with cystic fibrosis, but it's still great news. This is the first drug for cystic fibrosis in about 20 years, and also it's almost a cure for those who receive it. Another great example of personalized medicine is the AlloMap test. What is AlloMap? Well, AlloMap replaces heart biopsy for those who've received a transplanted heart. So right now, if you get a transplanted heart, you have two ways of following the success of that transplantation. One is biopsy. I haven't had a heart biopsy, but it requires lying in a hospital bed while someone takes out a piece of your transplanted heart. That's been replaced by AlloMap in many cases, which is simply a blood test. This blood test looks at some of your markers for heart rejection and lets you know if you're rejecting that heart sooner. And if you are, then you can get anti-rejection drugs sooner and do less damage to that transplanted organ. This is great for the quality of patient care because when you get a transplanted organ, you don't just get one biopsy, you get a number of biopsies. And being able to replace that with a simple blood test is an amazing evolution in healthcare. Now, it is an expensive diagnostic. List price is about $5,000. But it replaces what generally costs about $10,000 for a heart biopsy procedure. So I think that's just a great example of personalized medicine in terms of the quality of patient care, in terms of getting the right treatment to you sooner, and also in terms of savings to the healthcare system. Another great example of personalized medicine is the Oncotype test. Oncotype lets you know if you have breast cancer if there's a high risk of reoccurrence. If it's low, you can likely avoid chemotherapy. Chemotherapy is unpleasant. You know it's terrible. You've all heard or maybe even know people who've experienced it. It makes you sick, makes your hair fall out, you lose weight. It's extremely unpleasant. And being able to avoid it is a blessing. And I think it's a great advancement to the field.